Welcome back. Sometimes women chalk up symptoms like stomach pain or fatigue to just daily life. You're so busy, right? But with ovarian cancer, those signs can mean something more. As part of Ovarian Cancer Awareness Month, Dr. Baru Zand with Houston Methodist here to explain what to look for. So thank you for joining us.
Thanks
We
for having me.
appreciate it. How big of a concern is this? Why is it so important we pay attention?
Well, ovarian cancer can be a pretty serious, deadly cancer. We see about 20,000 cases a year here in the United States, and unfortunately about 12,000 women succumb to this disease.
You know, early detection with this one is so difficult. It's not the same as breast cancer, right? Like, we don't necessarily have these screenings to go look for it. So we have to listen to our bodies. What are those symptoms that women should not ignore?
You're absolutely right. Unfortunately, we don't have good screening methods for it. So the symptoms to look for, I use the acronym BEAT. So B for bloating, E for eating and feeling full, and A for appetite. And T for any kind of toilet changes, like urinary changes or bowel changes.
Okay, and this is really just needs to be based on what's normal for you, right? So
Exactly.
if you're out of your own normal, it's time to start asking some questions.
That's right. Your really good rule of thumb is if you're having these symptoms almost every day for like 3 weeks or so, it's probably a good time to see a doctor.
Okay. Who's at most at risk for ovarian cancer?
So the women that are most in risk, about 1 in 4 are hereditary. The most common genetic syndrome for this is called the BRCA gene, or BRCA. I probably remember that from Angelina Jolie being really famous a few years ago. That really brought a lot of awareness to this. But that's typically the highest, most common highest risk patients. But any patient with family history of ovarian cancer or even early onset breast cancer could be at risk. And also particular ethnicities like Ashkenazi Jews are much more likely to be at risk for ovarian cancer.
So if this is something that your mom faced or your aunt faced, your grandmother, this is really important to pay attention to.
Exactly.
Okay, why is it so hard to catch early?
And that is the complicated and very complex question that we have yet to try to figure out. It just seems to be that the aggressive type is really just kind of spreads like wildfire once it develops, and so it's really hard to detect it early.
Okay, so this is why, again, it's so important that you pay attention to those signs.
Right.
What's new in treatment today? Because you did say that there's some exciting new treatments.
Yeah. We're moving more towards kind of precision medicine. So traditionally we would just give chemotherapy. That was kind of like a paintbrush that we would give for all patients. But now we're doing molecular testing where certain patients with certain types of ovarian cancer, certain genetic markers like BRCA, we actually have new drugs that specifically target those patients, and they're doing much better than they used to before.
Okay, and so let's wrap it up with asking, if there's one thing that you want women to remember from today, what would it be?
I would say awareness is key, but empowerment is more powerful. Make sure that if these symptoms arise, there are things you can do to prevent ovarian cancer. Oral contraceptives. There are surgeries that you can do, like removing your fallopian tube during hysterectomy, that actually can decrease your risk by 70%.
Yep. Okay. And again, if you have that family history, I have it, not of ovarian, but breast cancer, finding that gene can be so helpful, because then you get in for more of these screenings as well. So, okay,
right.
Great information, doctors, and we really appreciate you joining us today. Jacob, we're going to send things over to you.
Oh, thank you for coming in such an important